Professor Prabha Chandra, thank you very much for having this little conversation here at the Marcé Society meeting. You've just received the Marcé Medal for your fantastic contribution to perinatal mental health research. And you've just given a talk.
That's right, yes.
Can you tell me a little, or tell us all a little bit about what you covered in that? In a, maybe in 1 minute. Let's see.
I'll try. So I basically focused on the fact that a lot of the risk factors for poor perinatal mental health, like domestic violence, poor social support, younger age of pregnancy, unwanted pregnancies, are really very gender focused and gender based risk factors, and particularly in South Asia. In most of South Asia, these gender related factors don't have a very good reputation. There are a range of reasons why there's lots of patriarchy and high levels of violence, be it in India, Nepal, Pakistan, Sri Lanka. And so I think that women are really at a much higher risk. And so any interventions that we do need to take this into account, because what happens is when we do interventions, we do a lot of work with the women, and we have peers and we have, community health workers working with women and helping them with cognitive techniques and things like that. But in the context that a woman is living in, a situation where she has to deal with all these challenges, really putting all the onus of change on the woman alone and not involving the environment or the system is probably not
almost
fair.
Seems irrelevant.
That's right. Yeah, well, I'm sure it works.
But not.
Yeah, but may not be as much as it should. Yes. Is it really sustainable? And how much burden does it put on the woman to make those cognitive changes?
Are we adding to the problems by, in a way, saying there's something wrong with you that we're going to treat? Yes. As a clinician working in a high-income country in the UK, with my team, when we would sit and discuss the women we were looking after, we would often, or reading through the referrals we were getting, we would often say, excuse my French, but bloody men, if it weren't for men, half these people wouldn't need our help. So even in a supposedly country with less inequity and less of the gender gap, we are, I think, seeing very similar problems. So I think we have much to learn.
Yes, I can imagine. And I think there are, so there are these deeply entrenched societal issues which can't be changed in a day. You won't expect, trials to sort of handle everything. It's impossible. But I think just getting men more involved and talking to them about gender equity, because pregnancy or preconception pregnancy and the early postpartum are times when men might change. It's a good window, to get men much more involved, because that's a time that they are a little concerned about their wives, a little concerned about the baby. They are willing to make changes. For example, smoking, decreases during that period.
Yes.
So men tend to be a little bit more gentle. So I think it's a good window when we can work with men and with systems. So what I was trying to say is that, one, of course, you work with women, and then you work with the men and the families, and then you work with the community. Because it's not enough for a man to change, because if his friends are going to say, oh my God, you're sort of, you're becoming henpecked, and why you're becoming soft, man. And the whole toxic masculinity thing which happens. So it's not going to work. So you have to have communities to change. And then you need to have health systems changing, because a lot of the gendered attitudes are within health systems.
And what about within the whole political system of the nation?
Absolutely.
So I know Jane Fisher did, for example, some work on changes in the law in Vietnam around domestic violence. It looks like governments have opportunities to do things that are almost free.
Absolutely.
That could make a big difference.
So India, for example, now has started these one-stop centers for women. We have 740 of them across the country. And we've just trained all the counselors in that to sort of, how do you look after the mental health of women who come to us, including young adolescents, including pregnant women, postpartum women. We're very, very worried about suicide rates among women in the perinatal period. So this is a good opportunity where women at high risk will go to these centers and get adequate care. So there are lots of little
and
opportunities.
And the centres are embedded in the community and can impact on community attitudes as well.
Yes, yes. Yeah, so the centres have a counsellor, they have a legal person, somebody who can offer free legal aid, and they have a police contact, so they sort of they do everything in one place for women facing violence or who are sort of struggling. So I think these are good places where we can introduce perinatal mental health. And because they're in the community, they are not in institutions or hospitals, or they are embedded within the community. It's a lot easier for them to make a difference. So I think that we need to tell the government what they can do, right?
Yeah.
Because we are the scientists.
Yeah.
We know
and
the
presumably
evidence.
the patriarchy is embedded in the government as well,
sure
as indeed
yes.
it is in most governments across the world. So we need to create shifts there
and
as
it's
well.
important for us to work not just with the health ministry, for example. Doctors tend to work with the Ministry of Health, but we need to work with the Ministry of Social Justice. We need to work with Ministry of Women and Child Development, so that people are talking to each other.
And the Treasury or economics departments.
Exactly. So I think that
there's a lot of work to be done.
A lot of work to be done, but I'm hopeful.
Yes.
Because I can see
change.
And
will we see change in this generation, or are we most likely to see it in the next generation? Because one of the things you didn't mention in your lecture, but I'm sure you think about a lot, is that actually all of the mothers we're looking after have been babies. And in India, you were describing how those babies are at risk of their lives through malnutrition, through neglect, through disinterest, through being rejected.
Absolutely.
And they will grow up to be the mothers of the future.
So there's going to be a lot of intergenerational trauma,
yeah,
which is going to be there. And we definitely need to work with boys, when they're young, so that when they become future fathers,
they're not perpetrating,
or at least they're ensuring that there's co-parenting, that
maybe
there's sharing.
breaking the cycle.
Yes, absolutely.
Inspiring and really, really interesting. Thank you so much, Prabha.